A gene therapy costing 16 crore rupees $2.1 million is the only shot of life for nearly 6,000 children with spinal muscular atrophy SMA type 1, a rare genetic disease. What is SMA disease? SMA means spinal muscular atrophy is a disease caused by loss of nerve cells, which carry electrical signals from the brain to the muscles. The protein needed for this signaling is coded by a gene for which everyone has two copies, one from the mother and the other from the father. A child develops this disorder only if both the copies are faulty. Without treatment, this disease is ultimately fatal. The disease as it progresses, makes it extremely difficult for the babies to carry out basic activities like sitting up, lifting their head or swallowing milk. Types of SMA. SMA is categorized by severity and age of onset of symptoms. It is estimated that 1 in every 6,000 to 10,000 babies worldwide is born with SMA. Development of sensations and the mind are completely normal in SMA. There are 4 different types of spinal muscular atrophy. Type 1, severe SMA. It is the most severe and the most common type of SMA. It is usually evident at birth or in the first few months, 0 to 6 months. Symptoms include floppy limbs and weak trunk movement, with the weakening of muscles leading to frequent respiratory infections and usually death by the age of 2. Type 2 intermediate SMA. Symptoms usually appear between the ages of 7 to 18 months. The rate of progression can vary greatly. The disease affects the child's legs more than his or her arms. Children with SMA type 2 can never stand. Respiratory infections are also common with this type of SMA. Type 3, mild SMA. This type of SMA symptoms can first appear during a wide range of years, from 18 months to early adulthood. Patients with type 3 SMA can stand and walk, but may have trouble getting up from sitting position. They have a life expectancy close to normal. Type 4, adult SMA. Symptoms for this rare type of SMA do not usually emerge until the second or third decade of life. Patients with type 4 SMA can walk during adulthood but will usually experience slowly progressive muscle weakness and other typical SMA symptoms. Treatment of SMA. It's not currently possible to cure SMA. Treatment and support is available to manage the symptoms and help people with the condition have the best possible quality of life. Zolgensma is a gene replacement therapy indicated for the treatment of spinal muscular atrophy (SMA) in pediatric patients. Zolgensma drug for the treatment of SMA type 1. Priced at $2.1 million for 5 years, the drug is one of the most expensive drugs to be approved. Thanks for watching video. Hope you liked the video. Please like and subscribe and don't forget to hit bell icon to receive notification.